So then that second question of how do we take things like this and take the global scale? Well, that's kind of what I'm experimenting with in my latest career moment, this work at Well, and I just want to make sure people, if you aren't as familiar with it, this is, what's fun about it is a standard that's trying to do at scale what I was trying to do back in that one school. What I like, has drawn me to IWI is that it kind of, from its start, it was designed to do both that direct, that kind of deterministic and kind of platform-based work, having combined both things like air, water, and nourishment, but also issues like community and so forth. And I think the thing that I'm most excited about, and I hear it already just in talking with all of you, I think we know that we're positioned to put forward healthy built environments as a way to act on some of the biggest pain points that are being experienced in the world right now, on whatever commercial setting, reopening safely, bringing people back. And so we're working along with you to try to make sure that people understand that they can utilize systems such as Well to take on these big pain points through the built environment. And also, I think the exciting part for me, but hopefully for you, and why we'd like to offer ourselves to whatever work you're doing, the IWI has grown tremendously, and so we truly are building a global community that we are hugely mission oriented and want to help. So we're in over 100 countries now, and are growing fast. So we'd love to work with all of you, and I hope you know that you have someone like me and who's been empowered to try to reach out to communities like yours. And so I hope that we can work together very soon. So thank you very much. Appreciate it.
That's excellent, and I know there's a couple of school principals in the room here, so they'll appreciate what you had to say. So I have a lot of questions, but of course, this is your chance to get your almost free lunch here. So who wants to be asked the first question? You, Martijn? Good. And the idea is that to hear you well, that you get this microphone, Dick.
Oh, that's cool.
Does it work? Yes. Well, first, Matt, thanks very much for this introduction. Very nice, very inspiring. Actually, I have two questions.
Sure.
I'm a financial economist, so the school example speaks to my heart.
Yeah.
But I wonder, is there some benchmark analysis that you did? Was this a lot more expensive than the old-fashioned alternative, just building a central building as a cantina? And the second part is, do you already have some sort of ex-post analysis of effects? So are the things that you were hoping for materializing?
Yes, and thank you. You didn't know it, but you were a perfect plant for me, because I should have emphasized that. Actually, that's the right question. The interesting part was as I told the story, like the client introduced the health focus in the middle of the project. Like the RFP had been long written, budget had been approved, and so forth. Actually adding the healthy features to this didn't change the budget. What it did do was change the design. Now, the thing that hadn't been incorporated at that time particularly was VMDO itself took on the cost. Like, it did cost them more in design time because they had never done anything like this. That was a learning lesson for me. As an academic, I had never, I was like, isn't just sitting around and talking like free? No, apparently. When you have fee-for-service architects who are not billing if they're talking to you. But so the real cost was actually the leadership overhead R&D effort from VMDO. But I think the key point is, I honestly believe in our school I can speak to, it's just better design, different design, but not more expensive. And then, sorry, the second part. Yes, we had 3 grad students who did their PhDs on this school, and so I'm happy to share. We did do a bunch of the actual guidelines were published, and there was a series of on the physical. One student focused primarily on physical activity, and we did find reductions in sedentary time. We did pre and post kind of accelerometers on children and so forth. And then the healthy eating work, there was also some positive effects, particularly around the idea of we think the long-term effect of these type of school building can be attitudes towards fresh foods and so forth. I know it's a little bit strange in a European setting, but in the U.S., some of these children, even though they live in a rural area, don't have easy access to kind of healthy vegetables and even just exposure in their home environments. So schools are a really key part of kind of exposing children to kind of being open to trying different foods. And so we saw some really nice positive impacts there.
Great. Jesus.
Nice.
To look into the light. It's a tricky one. All right. Well, this
the microphone creates drama when it lands. That's good.
It's very soft, so even if I miss, it's going to be fine.
My name is Hans Rijmoed from the Welfabriek. I'm a Well AP and Well Performance Testing Agent.
Wonderful.
And I was a little surprised in Well V2. Before in Well V2 pilot, there were much more chemicals has to be tested, and it has been reduced right now up to I believe 7 or so. Why is that, and why are SVOCs like flame retardants and so not tested in the air quality?
I'm going to have to refer you for really, really specific stuff to our standards development group. But so is it you're concerned about that it's less stringent in V2?
There are less chemicals being tested, and you breathe around 12,000 liters of air every day, so that should be clean.
Well, certainly the issues of like direct, as I said, the issues around like exposure to chemicals, super important to us. If you have a really technical question for us, I would love to refer you to our standard development team.
Yeah.
But yeah, happy to talk to you about it more about it. Yeah.
Do it. Okay.
Great. Yeah, I can just go here. See? Yeah, I can just go and drink coffee. This is all going well. Go ahead.
Yeah, the box is a good idea. Hi, I'm Felix van der Norst from Clarify. I have a question with regards to the development of Well globally. You guys are super big in the US and also taking off a lot, for example, in the UK and in the United Arab Emirates. Why is it that certain regions are taking off faster than if you compare it to mainland Europe? Because the UK is just a couple 100 kilometers away from us, but it has over 10 times the amount of projects that we have in the Netherlands, and also more than triple the amount that you see in France or Germany combined.
If you know the answer to that, we at IWI would love to know. All kidding aside, this is actually the types of things that I'm excited that Nils is putting a lot of energy behind this type of analysis, because I have my own hypotheses, but these are not based in any sort of empirical evidence. But what I noticed by walking around is as we enter into this sphere, it's very complicated, right? So in the U.S., healthcare is something that employers think about, right? So the issue of reducing healthcare costs is something that you argue for an employer. Obviously, in countries with nationalized health systems, there's a different dynamic. But then we heard yesterday in meetings at the UK that in certain environments, certifications are incredibly important, and they just kind of serve as proxies. So I don't know. We're trying to be honest, we're mission driven. I joined IWI because we really want the same thing, like healthy environments, equitably accessible across the globe. But we're working on that. Nils, do you have any comments on that?
Yeah, well, I actually wanted to ask a follow-up question that I wrote down earlier. So we have green labels, right? We have BREEAM, we have LEED, we have DGNB, USQA, and a gazillion more. What's the additionality of a healthy building label? And is there a need, is there enough in health and to have another label? And maybe that's also at the frugal Dutch. They say, well, I got my building already BREEAM certified. I spend money on an assessor. Yeah, there might be some additional hard and soft cost, even though I really think that's marginal these days. But do I then also, need to have another outlay for a well consultant and maybe some hard and soft cost?
I personally believe that this moment in the market development, I think there is a need to call out health and well-being as a particular topic, because I think it has enough specificity and I also think that the way we're going to develop markets is by highlighting it as an opportunity for differentiation. And again, I'm a doctor. My main goal is to I just want it to grow, but I feel in certain markets having it called out specifically is actually really valuable. There's actually that question gets even bigger and more thorny when we talk about health and how all these things fit into things like ESG. You know, there's like if you're a nerd like me, you know, if you want to get a good dinner conversation going with other nerds, is like, should health or social be pulled out of ESG, or should it be incorporated? You know, I think we're at a certain moment right now where figuring out those exact topics and how to drive a market and drive this consideration. I can argue it different ways, like any good high school debate team member, but we don't. We're working on it, and we're figuring it out. I think honestly, one thing I can say is, from doing this for a long time, being different parts of the kind of value chain of making places, you have to make different arguments for health, and you know, investors, you know, owners, occupiers, and then, you know, designers, they all have. You have to make a different value case to get this really rolling.
Yeah. All right, we're doing well. We're doing well. Yeah. Okay. Yeah. Wait, Pete. Guess first. I'll be more considerate here. There you go.
Hi, my name is Denise Orsten. One of the roles I have is more related to the culture and educational part that you just described in the example. I'm just intrigued if you, in any of your roles, would be looking, or will be, or are already looking at the long-term impact of that specific community in that, I think it was an elementary school in Virginia. Yeah. So I can understand that can have major impacts on their health as future adults, as US citizens. Is that something that you in one of your roles will be looking at, monitoring, or not at all, or maybe in partnership with public institutions?
The answer is, unfortunately, we weren't able to do it on, you know, and but it's not because it's not important or interesting. It's funding, you know, figuring out how to get research studies. When I was doing this work, it was almost, you know, 8-9 years ago. It was a pretty edgy idea, and actually even getting across the idea that to see, you know, public health was focused on that body mass index outcome. You know, at NIH, like, you couldn't submit a grant on this work if it didn't have BMI somewhere in the outcome measure. Whereas, as I tried to explain, I wasn't actually convinced that, certainly not within a 2-year grant, that wasn't going to happen. We weren't going to see that. This was going to be more like, you know, longer term culture was really going to be the thing. And then you also had to trying to get across to public health people that, like, actually an architecture firm needs to claim success on day one of occupancy. Like, so, you know, so getting across these types of things. So that's like how we were trying to figure this out. And that's part of why I argue for this. I wanted to make sure this crowd understood why I found the hardware-software frame to be because you can give the architecture firm a sense of, like, they delivered something that at least the group feels empowered on that day one. But to your point of culture, that is actually, I would encourage this group to, and it sounds like it's already happening in some of my small conversations, we need those types of studies that take into account, like, are designed to monitor culture, attitudes, long-term behaviors of things like the way, you know, children, you know, how they orient themselves towards physical activity for the rest of their lives, how they orient themselves towards healthy eating. I do believe that the built environment can be there's hugely successful in creating future sustainability advocates and people who are just have healthier behaviors for the rest of their lives.